The program manager of Diva Moms, with Diva standing for Dynamic, Involved, Valued, and African American. At Diva Moms, Kendra does, in her own words, her very best to show support to every mom that shows up with a need. And then we also welcome Ruth Richardson, who has been the president and CEO of Planned Parenthood North Central States since October 2022. She is the first Black woman to lead the 5-state affiliate, which consists of Iowa, Nebraska, North Dakota, South Dakota, and Minnesota. Ruth also served 3 terms as a representative in the Minnesota State House. And then our lovely moderator, Kien, is the Race and Health Equity reporter at Minn. Her reporting has earned awards from the National Association of Black Journalists and the Minnesota Society of Professional Journalists, who just last month recognized Ava as the Young Journalist of the Year. She's been doing fantastic work, so if you haven't been reading her work, you absolutely should be. So please join me in welcoming our panelists and moderator.
Hi everyone, thanks so much for joining us. We have Ruth and Kindra here, both who have amazing experience in the realm of maternal health and trying to improve a lot of the disparities. So we're going to talk a little bit about what those disparities are. In Minnesota, 13%, in 2017 and 2018, 13% of our birthing population was African American women, but 23% of those deaths, of the birthing maternal deaths, were African American women. So right there is that disparity. And I just want to hear from you, Kindra, about your work in trying to combat that and your personal story of what your birthing experience was like and how that led you into caring about maternal health.
Good afternoon, everyone. My birthing experience, I have had 2 experiences. My very first one ended in a loss, a stillbirth due to lack of care and teaching and understanding. My second one was, it wasn't as traumatic as the first experience. However, I will say I did have a better provider. And I also had family and a husband to support, as well as elders in my community.
Yeah, and when you say lack of care, what are the forms of care that really would have helped?
The total appointments that I experienced with my first pregnancy was a total of 6 appointments. So that in traditional care or in care today, we want our moms to be seen. There's a number of appointments that they should have. And I want to say, as a 17-year-old being pregnant, it wasn't something that was told to me by the providers. It wasn't something that was even told to me via home, with my mom, but I did get some care, but unfortunately it ended in a loss. So.
Yeah, and with how did that experience kind of inspire you to work with Diva Moms, and what was the beginning of your time with Diva Moms like?
So that's my drive. My drive and my passion comes from my experience. I've been working with Diva Moms for the past 5 years, and because I do not want anyone to have the experience that I did. I want every mom to be able to speak for themselves, to understand what's being said to them. And so a lot of times within my program, I have classes one-on-one or either in group settings where I'm able to teach the moms what to expect in pregnancy, what to expect from their provider, questions that they should ask. If you don't understand something, ask the question. And ask that provider to explain it in detail or use plain language. Sometimes when I have conversations with providers, I have to remind them, you're not speaking to a colleague, you're speaking to a person from everyday living. And so plain language is something that I remind our providers that they don't know medical terminology. I do, because I did some schooling, but when you're speaking to your patients, you also have to understand where they're coming from.
Yeah. And those health systems that, there are barriers for people knowing that terminology, being able to even access or go to an appointment. what do you find that the women or the people who come to Diva Moms are experiencing? What are their needs? What do they come to you for? What do you help them with?
From A to Z. I have moms who come to me at 6 weeks. I have moms who enter my program at 8 months. So my goal is to prepare them. I'm also a certified doula. So there have been some births that I've actually gone to. They've called me on a Sunday morning and said, I'm in labor and this provider is not speaking to me in a tone that I like. Can you come? My service let out and I was down to the hospital. You know, that's the dedication that I have for my program and for the moms that I serve. I want to make sure that with every mom that they have a better experience. You know, and if that means that they have to dismiss a provider and ask for a new one, it's your right. You can do that. And so I make sure that my moms know their rights while they're pregnant. And if you need to dismiss a provider, you have the right to do that.
Mm-hmm. And how many moms have you worked with in the past 5 years, would you say?
I think my mark is right about 532.
532.
532 that I've touched them. Some of my moms are not in Minnesota, so I have a reach that's a little farther than Minnesota, and I'm glad to have that reach. And a lot of moms come to me. Some of them just need resources. Some of them, recently I had a mom on this past week who contacted me who had gone through the program and she's homeless right now. You know, so what resources can I help her with? You know, I wish I had the money to help her do a down payment for an apartment or something of that nature, but resources are the financial resource is thin. But however, I do have a few connects in how to maneuver, I won't say maneuver the system, but get her to the next person who does have the finances. You know, so when they do come to me, it can be they need food. A lot of families are sitting at home and all they have is a box of rice. They have the bare minimum. They don't have the bare minimum. And they've got 2 and 3 kids. So finances is one of the biggest resources that my program could use.
Yeah, and Ruth, your experience in the legislature, you have worked on several bills trying to get more resources available for these families. In your experience there, would you say these deaths are preventable? Or the morbidity and what happens after? What can our state do better?
Yeah, I think that is the most important part